Good morning, everyone. Thank you for joining us. My name is Francesca Dominici. I'm a professor at the Harvard T.H. School of Public Health and director of the Harvard Data Science Initiative. It is with my great pleasure to introduce our speakers today for our fireside chat, and also the second keynote on the second day of the CAFE conference. So it is my pleasure and honor to introduce our second keynote is Vanessa Kerry. Vanessa is the WHO Director-General Special Envoy for Climate Change and Health and the Director of the Program in Global Policy and Social Change in the Department of Global Health and Social Medicine at Harvard Medical School. Her program helps examine the underutilization of healthcare as a tool to address economic, social, and cultural disparities that define poor health domestically and internationally. The program's signature initiative is on health system strengthening and crisis response. Dr. Kerry is also the founder and CEO of Seed Global Health, a nonprofit that invests in health system strengthening by training needed health professionals in resource-limited settings. These health professionals can not only provide quality of doctors, nurses, and midwives for future generations. She's also a physician at Mass General Hospital and serves as the Associate Director of Partnerships and Global Initiative at the Hospital Center for Global Health. Dr. Kerry graduated from Yale University, summa cum laude, and Harvard Medical School cum laude, completing an internal medicine residency and critical care fellowship at Mass General. She earned her master's in health policy planning and financing from the London Schools of Economics and of Hygiene and Tropical Medicine. Together with Dr. Kerry, we have also Dr. Mary Rice. She is a director of the Institute for Lung Health. She's a director of research and associate professor of medicine. Dr. Rice's research focuses on preventable causes of chronic lung disease in children and adults, including environmental exposure such as air pollution, climate, aerial allergens, and microbes. Dr. Rice is the director of the BIDMC Institute for Lung Health, a multidisciplinary respiratory research program that applies advanced statistical and sampling methodology in clinical population with chronic lung disease and multiple US-based prospective core studies of children and adults. A core mission is to identify preventable causes of chronic lung disease and to translate research findings into patient care and health policy that improve lung health. Most of Dr. Rice's research is funded by the National Institute of Health. So welcome and thank you very much for joining us, and I will let you for your conversation.
Thank you very much, Dominici, Dr. Dominici, for the very kind introductions. It's really a great honor and a pleasure to be hosting this discussion with my friend and colleague, Dr. Vanessa Kerry. Dr. Kerry, I'd like to start our conversation with your general thoughts on how climate change affects health.
Well, first, thank you very much for having me today. And I'm a huge admirer of both of your work, because you are truly transforming the science of this moment that we need to actually make the decisions to deliver better care to people and to protect their health and well-being. So I am incredibly grateful to be able to join you and hope to learn actually very much from you.
Likewise.
And continue to learn. You know, the climate crisis is a health crisis at the end of the day. And what we are really discovering is that there is not an aspect of human health that is not being impacted by climate change. Whether it is our mental health, from the anxiety we feel every day from what's happening in the world, the fact that extreme heat can worsen psychosis or diagnoses, whether it is worsening maternal outcomes, whether it is cardiovascular disease, kidney disease. We're seeing it in every realm of our well-being. Vector-borne diseases. I mean, we're seeing more cholera outbreaks around the world that are tracking from one country to the next nonstop. And so we're seeing very much that everything that all the progress that we've made on the Sustainable Development Goals, all the progress we've made and the billions of dollars we've put in global health are being eroded by this rising climate challenge now. Part of the problem is, though, we don't talk about it enough, we don't recognize it enough, and we don't see it enough, right?
Yeah.
We talk about climate change and our progress in climate change in terms of degrees Celsius averted, not in the degrees of lives saved. And yet, ultimately, what we're talking about is our human survival, our planet's survival, and our ability to function and have healthy societies, to have economic growth, to have security, individual, national, and otherwise. So we have to start to reframe the climate crisis as one that is actually a crisis of human survival, a crisis of human health, and really a crisis that has to be discussed at the highest political levels as much as we're discussing it in our scientific community.
I really appreciate your framing this in terms of lives saved. Whose lives are saved? Who's impacted by climate change?
Every single human being is being impacted by climate change. I mean, if you just look in our country now in the United States, the floodwaters in LA and the mudslides are affecting one of the communities that we should think of as being extremely developed and extremely safe and extremely advanced. We've seen extreme weather events accelerate across this country throughout, 2023 was an apocalyptic year in terms of extreme weather and extreme climate change. Extreme heat. Phoenix lived above, in the 3 digits for over 31 days. We have seen wildfires in Hawaii, across northern Canada, across the world. We've seen a drought in the Horn of Africa that's affecting 120 million people. There's not a single human being that is safe from climate change. What I think the question is, who is safest is determined by the resources you have and whether or not you're already more vulnerable. And what we're really seeing is that those that are already the most vulnerable, who are contributing the least to climate change, are those that are the most impacted by climate change and have the least amount of resources to be able to adapt or have the resilience that they need in this moment. And so what we're seeing is that climate change is actually driving and worsening inequity, and it is actually worsening the challenges that we see today, which means that climate change is becoming not just a direct health problem, but an indirect health problem as people lose access to work, they lose access to income, and as they're forced to move from their homes, because migration is a form of adaptation now for climate change, almost half the world today is vulnerable to the impacts of climate change. And we're seeing that climate change is going to exacerbate problems that already exist. 2 billion people don't have access to safe water. 770 million people are already hungry. So as climate change changes our food security, our access to sanitation, you're just going to see those numbers skyrocket. I'm not trying to be alarmist. I say this profoundly pragmatically because if we can acknowledge the problem, then we can start to get very realistic about the solutions to solve it, because we have all the tools. We can solve this problem if we choose to.
So one of your many roles is as CEO and founder of Seed Global Health. Can you tell me a little bit more about your organization's mission and what it does?
Absolutely. So Seed Global Health is an organization that fundamentally believes that it is unacceptable to have 2 such different standards of care in the world, especially in 2024. Now, the painful part for me is I've been saying this point since we started in 2013, and we're slowly closing the gap, but we're not closing the gap as quickly as we could be if we choose to. We do our work by training the healthcare workforce, because healthcare is fundamentally a human-centered intervention. And the ability to meet the health challenges of today, to provide dignified, high-quality care, starts with a healthcare worker. And so we've trained over 34,000 doctors, nurses, and midwives in the last decade in service to catchment areas of over 73 million people, working primarily in sub-Saharan Africa, where you see some of the largest burdens of disease, but the least amount of workforce to address that disease. Mm-hmm. And what we've learned over the last decade is that by partnering closely with the governments and the public sector and the institutions with whom we work in sub-Saharan Africa, and really aligning ourselves behind their priorities, we actually can build sustainable, long-term changes in health outcomes that are being led by the healthcare workforce. And so that might mean being able to respond to Ebola in Uganda and to help train 4,000 healthcare workers to be able to create a ring of knowledge and understanding and triage to look out for Ebola. It might mean responding to the cholera epidemic in Zambia right now that has killed over 500 people and infected 13,000 and puts millions of school children at risk as the schools have closed down for cholera. In Malawi, it's been setting up birthing centers and responding to cholera and training family medicine doctors. And in Sierra Leone, it's been through training midwives over just a year and a half in a district that has 44% of the country's maternal mortality. And this is a country that has the highest maternal mortality rate in the world, 50 times the likelihood of dying in childbirth in Sierra Leone than in this country in the United States. And after a year and a half of education and training, we supported our partners to be able to see zero maternal deaths for the first 5 months of 2023, and overall throughout the year drop maternal mortality in the district where we're working by 60%. And that's been sustained. So we know we can make these changes. The question becomes, how do we scale it? And I would say that the work SEED is doing is critical to climate change, because as we've done our work, we have seen how our work has gotten harder because of climate change, because it does create the storms that cause the cholera outbreak, because it is exacerbating the amount of disease that family medicine doctors are seeing, or rising, increasing the risk of preterm birth. So we're really out there championing the understanding that the single most important investment we believe we could make for the adaptation and resilience of health systems and climate change is a health workforce, because that health workforce then can articulate the priorities and the needs that are required to rise to this moment and to meet the challenges, and can help define the investments we need to make.
Got it. Well, clearly, you have a great passion for improving healthcare delivery around the world.
Well, the moment's urgent.
Yes. And at this CAFE conference, there's many sessions around related topics about preparing the healthcare workforce for the climate crisis, making the healthcare sector more resilient so it can address the threats of climate change and take excellent care of patients. Can you talk a bit about how the climate crisis is a critical issue, specifically when considering healthcare delivery, and perhaps give some more examples of how you see climate change directly affecting our ability to deliver healthcare, especially in resource-poor settings?
No, absolutely. I mean, I think the reality is climate change is going to impact our ability to deliver healthcare again in any setting.
Yeah.
If you look at the United States, we have been besieged by extreme heat, and that extreme heat has led to people not being able to go to work, has exacerbated medical problems, and puts a demand on our healthcare system here as people respond. Or as we're seeing air pollution and the wildfires from Canada turn New York City orange, people are wearing masks, ironically, more masks, it seems, from that than in COVID. But people end up in the emergency room. And it taxes the system and it demands the system in ways that we're not really equipped to, or fully prepared for. But it is in those countries that are vulnerable or have the least resources that are seeing the impacts of this the most, because again, they don't have the ability to adapt in the same way. They don't have the resources. And so if I give the example of Malawi, where SEED has worked now for 13 years, Malawi is in Southern Africa, for those that don't know, and Southern Africa has been hit by probably an increasing frequency, increasing severity, and increasing length of storms over the last couple of years that have compromised drinking water, assaulted infrastructure, and increased vector-borne diseases. So the malaria season now in Malawi used to be that when the season was at its height, you might see 2 patients to a bed, 3 patients to a bed, nothing we would see in this country, but sort of known, expected. I hear reports now of up to 8 people in a bed, people down the hallways, just the complete surge of disease that we're seeing now.
8 people for a single medical bed?
I mean, I've heard reports that sometimes it gets that severe, that congested. And I think, Pakistan gives a great example too. The floods that hit Pakistan after 2021 led to a 4-fold rise in malaria in 2022. So that in provinces where it had been eradicated, you actually were seeing malaria come back again. But I want to come back to Malawi. So a couple examples of how climate change has made delivery of healthcare worse in Malawi. So one, you see the surge of malaria cases that are overwhelming. But Malawi has about $34 per capita per year to spend on health. So if you think about that, that's like 4 or 5 Starbucks coffees, right? For healthcare for a person in this country. A basic package of services, though, to provide the bare minimum of sort of WHO recommendations and what's been defined by the government as being an appropriate package of service, is about $74 per person. So we're already seeing a gap of $30, $40 per person to pay for even the most basic healthcare. Then you have these storms, though, that come through, and they wash out the bridges to the birthing centers so that women who are more likely to have a preterm birth or a complication in birth in the setting of an acute crisis like a storm that has washed out the water or injured their house or caused damage, they are not able to actually access the birthing services they need. So then you're having to rebuild new centers that are accessible, which is an increase in resources that are needed. It's a distraction in the delivery of services. It's an interruption of services that we're seeing. But you also have a cholera outbreak that is now over, but Malawi saw the longest and largest cholera outbreak it had ever seen in its history, which led to thousands dying, tens of thousands being infected, and schools shutting down, businesses shutting down, the government unable to travel, and you can just, the reactive resources that have to be spent mean that Malawi doesn't just have a gap of $40 per person to provide basic services, it's going to have even more because those resources are going into reacting to healthcare. Our supply chains get interrupted. We don't have access to clean water anymore. Everything we try to do gets interrupted by climate change. We already know that our health systems globally are not prepared for shocks. COVID showed us that.
Right.
In COVID, 90% of countries had a disruption of services because we hadn't made those investments in strong health systems that could be responsive, be resilient, or a healthcare workforce that served on the front line. My hope is that we can take this moment and recognize we have plenty of lessons learned. So what is it going to take to spur us into action in this moment to create the changes that we need? It's worth noting, we spend more reacting to the impacts of climate change than we do if we invested on the prevention side. For every dollar invested in health, we could see $2 to $4 of economic return, for example. Healthcare workers see investments. Where you invest in healthcare workers, you can see a 9-to-1 return. Some of that's social, in terms of gender equity, 70% of the healthcare workforce is women. Some of that is economic return. Some of that is just in general cost savings, but we have the ability to make better and different decisions. I think it's incumbent on all of us and everybody watching here to think about how we can start to shift the conversation so that we are making smarter investments in our resilience, in our adaptation, and to be able to meet this moment differently.
Got it. I have a question for you about investments and resources.
Try to answer.
So I'd love to hear your thoughts about the balance in where we invest our resources when it comes to addressing the climate crisis itself and mitigating climate change by reducing carbon emissions, and dealing with the fact that climate change is already happening, already making people sick in so many different ways, as you just described, and helping adapt to the crisis that's already underway.
It's a great question. And I think, make no mistake, the single most important thing we can do is to phase out fossil fuels. Fossil fuels are without question the cause of all of this, right? And that is what is driving us to this tipping point. We are on track for 2.9 degrees right now. We're supposed to be at 1.5. And technically we are already, we've seen an acceleration of temperatures where we're spending a third of our days at 1.5. And look at the kind of crazy events that we're seeing already happen with these changes. So we know we're falling behind. And the only way we're going to be able to even have a chance at this is if we figure out structure timelines targets for mitigating our fossil fuel use, which does mean we need to spend some money on mitigation. Yeah. And we need to be focused on thinking very carefully about our contributions and ways that we can reduce that impact and have a just transition. That said, the majority of our money goes to mitigation. And especially in the health sector, we've done a better, more advanced job about thinking about how the health sector mitigates its contributions to fossil fuel. We are not spending enough in any realm on the adaptation and building the resilience we need for the shocks that are already happening and will continue to accelerate. Even if we shut off every fossil fuel today, we would still see a rise in temperature before we're going to see the improvement. So we have got to invest in adaptation and resilience now. It was interesting just at COP because there's a lot of pledges for loss and damages. There was a lot of pledges to increase the funding available. And it was exciting to see loss and damage fund come out on day one, right?
Yeah.
The problem is loss and damages got funded to a tune of less than $1 billion. And yet the UN Environmental Program and others have said that it is going to be at least $366 billion a year to manage the adaptation and resilience investments that we need today. So the gap there is huge. You then put that into the healthcare realm, and we're even more in trouble because only about 0.5% of any adaptation funding is going into health and into the resilience of being able to counter the climate change impacts we're seeing in health. And yet we know that the climate change is driving and increasing the burdens of disease for everybody, everywhere, and putting us all in danger. So we have to close the financing gap. COP28 was exciting in that they said there's a $1 billion fund coming for climate and health financing, and everyone got excited, except 800 million of that is already pre-committed, pre-earmarked, and not new money. So we do have to ask ourselves again, how are we going to really meet this moment? And where's that funding going to come from? And what is our responsibility to, as those that hold the consolidated wealth, to be able to make these investments that can be felt by more elsewhere? And I think that this is where we as a health community have to do a better job of advocating for the science that we do know, telling the story, not just in an academic journal and just putting the knowledge out there, but translating again what that means for human life. And how do we respond to that? What is the solution if we know that problem or we know that data? How do we take that to the next level to say, here's the point of action? And I think part of that is going to be the health community taking that science and translating it into economic terms. Because the blunt truth is policymakers, private sector, and those that have the ability to accelerate the solutions and to make the investments at scale in the way we need to are driven by economic decisions. Not saying this cynically, saying this totally pragmatically. Because if we have a lot of the data that tells us what the economic cost of health is, 100 billion in productivity in the United States from extreme heat alone this year. It's going to double by 2050 at the rate, or I think it's over the next decade. Someone needs to look up that fact. But the point is, it is going to accelerate from the 100 billion we're at today. So we know there's costs there. So if we could put this into an economic currency in a way that hopefully could compel governments to see the economic protective action of investing in resilience and adaptation, and we should mobilize more money. But we need to also make this a cost of doing business for the private sector. Because if the private sector realizes this is their supply chain that's at risk, it is their workforce that is at risk, it is a tax base and their consumers and their markets that are at risk, maybe investing in the adaptation for climate and health becomes just a cost of doing business that actually can also be the right thing. And so we absolutely have to accelerate the amount of funding that we are putting into our protecting our health and our adaptation. But it's going to be, we have to also realize as a global community, we are spending way more reacting than we would if we just did the upfront prevention. And Prime Minister Mia Mottley of Barbados said it really well at COP when she's, on the second day, she said, look, for every dollar we spent in adaptation now, we would prevent $7 in loss and damage. That's a no-brainer.
Seems like a worthwhile investment.
So we can do a better job as a health community, I think, making these linkages across health and really helping to bring the solutions forward in a way that can become palatable and easy for those that we want to take them up.
Yep, got it. We are very far behind in terms of our investments. It's clear that we have a lot of work ahead of us, and climate change can sometimes seem like such a huge and intractable problem. And I'd love to hear from you about what you see as success stories, whether it's at the local, national, or global level. What gives you hope, Vanessa, that we can do this?
I am, without question, an optimist. Because I think when you look at the science and the technology, sitting here with both of you, when I look at the way you have propelled this field, you have put the information and helped to accelerate our understanding of how certain actions lead to harm and how we can take different actions to protect our health. It gives me hope because we can put that science and that brilliance and that kind of and the drive to solve these solutions in an evidence-based way to work in the right way. And I think where you see success stories are in places like Malawi, where I just told the dire tale of cholera and lost birthing centers, to a minister of health who knows exactly what her priorities are to invest in the well-being of her population and to meet the climate change challenges. And she will tell you, number one, stop using her country. Stop saying that you're going to go help Malawi and then take the money and just build your own programs. Actually partner behind her in her single vision for her country, her single budget, and the ways that she can not only respond to the resilience of climate change, but she can meet the burdens of disease that are killing her population today, here and now. She has a plan, right? She has the vision. She has the knowledge and the wherewithal. She needs the support, but it gives me hope to see that kind of thinking and that kind of call to action come from her. She has been prioritizing midwifery and family medicine and mental health in her country, burdens that she knows is going to keep her country from being able to achieve all it needs to achieve. The president of Malawi will publicly talk about the single most important investment for his country is building a resilient health system that can protect his population, and that the climate crisis is a health crisis. And so to have that be spoken by a president of a country is pretty extraordinary. We know that we have, so I have a great amount of hope that we can change this moment. I think we have to be very thoughtful about how we do it, because how we've been doing it is not totally working, right? Or we'd be a little bit further along. So we can't just double down on what we're doing now. We need to think creatively about how do we change the conversation and bring forth. The fact that there was a first ever Day of Health at COP28 was very encouraging, because it allowed, and it was on the third day, right? First thematic day was health. That means that we're starting to take this seriously. We're bringing it to the highest political levels, and we can change this conversation differently. There were funds pledged. That is encouraging. Do we need to do more? Yes, but we'll take that. Fossil fuels was verbally included in the language coming out of COP28 for the first time ever, acknowledging it's causing climate change. It's a step in the right direction. Yes, we need to get to phase out. We have to take these moments with hope, with encouragement, and then we do have to ask ourselves, how do we build on this momentum and go to a different level? I take great hope in this younger generation, right? I have to classify myself as an older generation now, but the younger generation does want something different. And I believe in generational change. And so it's up to us to listen and to think about how those of us that are in positions of power and decision-making can actually learn and take the bold steps to do something differently. But we are fighting for our survival. And my hope is that we're starting to finally see the inflection point in the conversations and in the acceleration of acknowledgement that will then allow us to make different decisions. And I think that's encouraging. But we also can't take our foot, I mean, it's a bad pun on climate change, off the accelerator, the electric car accelerator.
The bicycle.
The bicycle, right? So thank you. We have work to do, but we shouldn't be afraid of that. We should be challenged and motivated by it and excited by it, and to think of the possibilities of what we can unlock if we cross disciplines, get pragmatic, and get honest about where we are.
I have a quote from you.
Oh, good Lord.
That you gave in your recent address at the opening of the Reaching the Last Mile Forum, which was at COP28. And you said that now is the time for bold and decisive action by every single one of us in the room. The time is now. And here we are at this cafe conference, which brings together so many different stakeholders from different sectors: academia, government, nonprofit, funders. What do you see as key opportunities for all of these people gathered here virtually to come together across our different silos and to try to bring solutions to the health crisis of climate change?
I think it is really important for everybody to know that every single one of us has a role and accountability to this moment. And if we are not part of the solution, we are part of the problem. But that can be anything from having a personal moment of accountability about what is my climate footprint and how can I reduce it and make different decisions that can contribute. What conversations can I have within my community to help influence decisions, or do I see a problem? And am I going to wait for somebody else to solve the problem with the way we are utilizing a certain resource among our neighborhood, or can I be the champion of solving that, right? So there's the individual accountability that matters more. That matters that each of us are engaged in. The individuals have a critical responsibility to vote, no matter what country you're in, and some countries are better than others in terms of the democratic process, but inherently everybody should have the right to vote and needs to exercise that, because the leaders we have today are absolutely essential to the direction we're going to go from this moment on. And so exercising our voting power, getting involved in the democratic process, and ensuring that leadership gets elected, we cannot be passive in this moment. We cannot take a back seat, and we cannot assume the right outcome is going to happen. We have got to make sure that we have leaders out there that are reflecting the need of this moment, and we are no longer suffering from a pandemic of poor and expedient choices from leadership that is just worrying about their own survival and not the survival of the greater good. For academics, we have a really powerful responsibility to not live in an ivory tower, to not generate knowledge for the sake of knowledge, but to generate knowledge that is in service to this moment and can propel action, and to ask ourselves, once our paper is published, not what is the next paper I'm going to write or the next question I'm going to answer, but how do I take this paper and make sure it is in the right hands of policymakers, it is in the hands of people who can use this information to change decisions, to change their actions, and to be able to create the kind of good, because that is why we generate knowledge. We generate knowledge to be able to be used. So we need to take that extra step. I think for funders, philanthropic funders have the ability to be critical, catalytic, and flexible bridges to put pilots into action to see if they work, and if they don't work, to be okay with that, to learn from it, and to then fund the next pilot so that we take it the next step. But to mobilize that capital to create the opportunity to learn through implementation and to learn through service so that we can be able to scale that change over time. And that scale can come from governments, from world banks, from bigger agencies and foundations, but those take time to mobilize. So philanthropic capital can be absolutely critical to those funders that have their own agenda. I would ask them to listen to the priorities of those that we are in service to, and those that are most at risk and most vulnerable, and to put your funding behind those that are vulnerable and behind their plans, behind the Minister of Health in Malawi's plan, so that she isn't responding to 6 different people's agendas. We are all in service to one country, one people, one budget, one plan. And I think for governments, there's an ability to mobilize funding. If you're worried about your security and your defense, you should be worrying about climate change. 1.2 climate migrants are going to be, between now and 2050. We're seeing an influx of these migrants come across borders to Lebanon. They're moving across Northern Africa. They are coming across the Darien Gap at record numbers now in South America. So for those that think this is, not an issue, it's a security issue. Maybe we should be mobilizing some of our budgets there so we can change our funding budgets.
Industry, could you comment on industry too?
I was just getting there.
Participants.
So industry in the private sector has an absolute necessity to understand that investing in the adaptation for climate and health is critical to their cost of doing business. And for those companies, like pharmaceutical companies who are driving climate change through the extraction of resources for R&D or for drug generation or for their supply chain, the supply chain is responsible for 50% of the health sector's contribution to climate change. Patient care pathways need to be looked at. How can we do better telemedicine appropriately, triaging, bringing health to the community rather than the community into the hospitals, to think about, again, how we're reducing the footprint of climate change through that. And industry and private sector need to think very carefully about how much profit they actually need. Because at the end of the day, we're watching profits consolidate into smaller and smaller sort of people and resources. And what we're ultimately building is sort of a feudal system. It's going to be really controversial what I'm going to say, but we're building a system where a few people hold huge amounts of wealth and many more people don't have the wealth they need to be able to be safe in this moment. That is an unsustainable system. And so we have to really rethink how we are organizing ourselves. And I'm not saying people can't make money. That is part of our system in this world. But I think we have to think about how much and when and how we can reinvest some of that into global public goods that serve all of us. And so we have to have very real conversations about that as well. And for governments need to think really long and hard about what it means to be bold and in service to their populations right now, and to not just worry about the next election cycle and surviving to the next minute, but really laying the groundwork and the framework for our sustainable well-being. Because actually, I think that can get communicated in a way that can ensure their next re-election. But we need to be willing to make those choices because the system we have now is just not sustainable. And this brings me back to that point where we as consumers, we who vote, we who live in this world have to demand something different. And we don't need to be militant about it, but we need to be fact-based, evidence-based, and engaged. And I think that's our moment of accountability, and one that does need to draw across every sector and every discipline. And we need to ensure that if we have opportunity and power, we are thinking about how we use that for the greater good, not for our personal good.
Thank you, Dr. Kerry. This has been an incredible and inspiring conversation about bold action. I want to make sure we have time for questions from the audience. Dr. Domenici?
Thank you. I was just going to say that. Thank you for this encouraging and powerful message. I really enjoyed your conversation. So we have a large audience and a lot of questions, so that I'm going to just pick some. So let's see. All right, so let's start with this. A large percentage of people that are watching are scientists and people in academia. And so they're wondering whether either of you, by the way, and we'll start with Dr. Kerry, has some ideas of what, or some suggestion of what are the current research priorities for the climate and health perspective. And how can academics contribute more to action directly? So, Dr. Kerry, maybe I'll start with you and then I'll move to Dr. Rice.
I think we have done, I think there's an opportunity to outline a couple core research questions. Without question, we have to keep accelerating the science of sort of causality and linkages, right? And make that irrefutable. So I think really understanding the ways that certain aspects of health are impacted by methane or by fossil fuels or by air pollution, and documenting exactly what that looks like across different disease burdens is going to be important, so we can really define that. I do think we have a lot more work to do still in quantifying the degree of the impact within the community level. So I think we have big numbers that are sort of happening, and we can speak to the 8 million deaths that are happening in air pollution, and that we can attribute, 5.1 or 2 million of those are from fossil fuels, or the linkages between coal and, which Dr. Domenici has done so well, and how it, and then the particulate matter and how it impacts our health. But what does that actually mean for the individual patient and what does that mean in a community like Malawi, or what does that mean in an inner city versus, so if we can disaggregate it a little bit to understand the precise needs of different communities, then we can start to actually determine what are the interventions that are going to change that health in the right way. And so sort of quantifying it and articulating the details of it, I think there's still a lot of work to be done. And the Wellcome Trust releases an RFP that I think will be out in April, for example, that is asking just this question, to really dive into being able to really map some of this detail a little bit more. I think we need more work on what the true economic cost is too, because I think if we can really define the currency of health and that link between economics and climate and health, then we have a tool that we can go to policymakers, to governments, to the private sector in a very different way that can hopefully spur them to make different decisions and actions. But I think creating that economic costing is going to be very important for people to sort of understand, because then they're going to be more inclined to want to invest on the prevention side. And I think we need to. So I think we need to define the security crisis that is coming. So I'm going to take this from a policy viewpoint, because I think this is where I see the levers can get pulled in big, scalable ways. But if we can also document the security crisis that is being created from climate and health, over sanitation, over water, over hunger, food security, migration, answering some of those questions, disease burden shifting as they move with populations. Cholera went from Yemen to Iraq to Syria to Lebanon, for example. And so I think mapping some of those patterns, I think we'll do a better job also to be able to create some of the policy changes that we need to answer some of these questions. And I think there's a paucity of data on how women's health is being impacted on climate change. We talk all the time about women and children being most impacted by climate change. And we can say, well, women are being sexually assaulted in Kenya because they have to walk farther to get water. But how many? And to what degree? And what does that actually mean for their children? And then the long-term implications for society. Documenting that will hopefully change the value of how much, and I say a global we, there are some of us that care deeply about this already, but how we're going to respond to this moment differently. And so I think there's huge opportunities across those research agendas. And then I would say the implementation, right? So taking just the knowledge of some of that, sort of how these aspects of human health are impacted by climate change, and again, being able to spell that out in terms of epidemiology, and evaluating programs that are looking at adaptation and what is the impact of that again, because we also have to make sure that we're actually helping things as we're creating these adaptations. So it's a long answer because the research agenda is huge. So for all of you academics out there, I'm delighted and I'm happy to help define what some of this can be. But I'd like to hear from you, Mary, too, as you run the Lung Institute and are asking these questions and are teaching young learners. What's the research agenda for you?
Well, I think one of the big priorities now is thinking about solutions and what the benefits are of those solutions. So there's a wealth of research, some of which I've been involved with, documented, Dr. Domenici, certainly. There's a lot of work that shows that burning fossil fuels is unhealthy. It pollutes the air, makes people sick. When we address climate change, right, when we stop burning fossil fuels, there's a health benefit that can be quantified. And so in addition to quantifying the health effects of climate change at the micro scale, at the macro scale, I think we also need to quantify the benefits of action. So, how many lives are saved when we transition away from burning coal to renewable energy? How many lives are saved when we move away from burning biomass indoors and build sustainable clean energy infrastructure in low resource settings? How many lives are saved when we transition away from meat-based diets to more plant-based diets? So in addition to the health effects of climate change, I think we also need to think about the benefits of action, the benefits of the solutions that we have in front of us. And those can really be studied as we do experiments, as we implement some of these changes.
Well, I think this is a great comment to, and then a great segue to the next question, which basically said, climate change and health is complex and all of society issue, and we have discussed that. Action is required, we have discussed that. Coordination action is required. Now, what is needed for everyone to respond together, or do we go about this in silos? And maybe let's elaborate a little bit more specifically about this, because I've been thinking about, as you were talking, right? So when I think about people in academia and the scientists, someone like myself, we spend 5 years to get all of the data and all of the analytical approach and say, coal pollution is dangerous. And then Mary, more also from a scientific viewpoint, but also from the medical viewpoint in terms of what does it mean to the patient. And then Vanessa is also mentioning correctly how that translates to action. How do we make a difference? How do we quantify the difference? The problem is that to go to the entire pathway from basic science research, population research, clinical research, translating to action, require a tremendous amount of time and collaboration and coordination. And I think, personally, we are not there yet, right? There are not many opportunities to have a conversation like this. And so I'm wondering, both from Dr. Kerry and Dr. Rice, the goal of Climate and Health Research Coordinating Center is really trying to mobilize the entire research community so these sort of interactions are accelerated. What are your thoughts? In terms of, we have now this opportunity. What do you think would be the concrete mechanism to really have a more effective, accelerated, action-oriented dialogues between scientists, between the clinician, and between the policymakers? Hard question, but
Can I go first?
you're up for it.
Oh boy, I'm not sure I have the perfect answer here, but I think we need more discussion, right? And I have a few thoughts. So just to give you an example, so I was talking about the health benefits of climate action, and a group of scientists from the International Society for Environmental Epidemiology, I was part of this group, we put together a 2-pager documenting what we thought were some of the big benefits. And we wanted to tie dollars to that. But we felt like it wasn't our area of expertise, right. So we went through the literature and we put what we could find in there, but we didn't have health economists, right at our fingertips that we could call to get some of those dollars in there. So I think that would be, my vision would be that the epidemiologists and the medical doctors would be able to reach out easily to the right experts to get those dollars when they're needed to try to influence policymakers. So that's one example.
I'm sorry, I'm laughing because I feel like I'm going to be very candid, probably to a fault here. I've spent the last decade trying to convince a lot of people, especially in academics, that this is the exact intersection of what has to happen. Because we have got to create a community of practitioners to draw on. I'm at Harvard. We have an unbelievable group of practitioners, from the medical doctors to those that are working in vulnerable settings, to the bench researchers, to the researchers that are looking at the population level, the School of Public Health. We have we have all these extraordinary schools, business, Kennedy School, all these folks, right? The medical school. BU also has an unbelievable series of practitioners, that are working locally, that are working internationally, that are part of this community and are raising these questions. But there has got to be the ability to create that into the translation for policy change. And what that does mean is creating a hub, to me, a center, a hub, a community of practitioners where you have those that are able to translate literally the bench science into what that actually means to a policymaker or a community, and that it would house health economists and it would house, representatives from the bench community. But it's those of us, that I think can translate from reading a paper in bench science to be able to then think about what is that action. And but to create and invest in that as a core contribution of academia to service a moment and to be in service to, I believe, academics or academic medicine, for example, it's patient care, it's research, it's education, and it's service. And part of that means creating that ability to take that core research and create a community of people who can turn that out into the language that the non-health community can understand in action. And that is a deep need. Please try again. Oh, my Siri's talking to me. She likes the idea. And I think that is a deep need. Now, does it have to sit in academics? No. I think it would be better empowered in academics, because I think that really understanding science and bringing together that community of academics and the different lenses and the different research is really powerful and can sit well. But it's uncomfortable for an academic institution to think about what it means to then translate that externally. And yet I also think academics would be well served for it in a moment where we're under assault, right? About being rarefied, about being out of touch, about being, so we also have a responsibility, I think, to rethink who we are as academics. And so I think you could create a really interesting and extraordinary community that sits drawing on the practitioners, lawyers who know regulation, and the business community leaders who know how to translate that into actual strategic enterprise. And the Kennedy School folks who live and sit at this policy and say, well, no one's going to understand that. Here's the question we need to solve. And then you get some folks in a room who can do that together. So you can draw on the wealth and diversity, I think, of a community like BU's, like Harvard's, or all of us together in Boston to do this. But somebody's got to be willing to stand up that vision and to muddle through it. It's going to take, we're gonna solve for it. But I'm laughing because I think that it's an uncomfortable place for academics to go to, and yet it's probably the most powerful kind of instrument of change that we could use, especially for climate change and health in this moment, and to respond to that really deep multidisciplinary piece. And so I would really encourage us to think hard about how that could get created. And speaking of demanding something, demanding that of our leadership to be able to do something creative, innovative, and really impactful. So I love that question. Thank you.
Yeah. I think it's up to us, and it's definitely time to be bold and transformative. So we are almost at the end. I wanted to give both of you an opportunity to just say a few thoughts as we're wrapping up. I have a question, but you can say whatever you like. My question is really if you wanted, as you're thinking about your concluding thought, to really think about the many, many students, postdoctoral fellows, junior faculty, young people. They are younger than us for sure. They're watching today because, one of the amazing opportunity I think that the Research Coordinating Center has is really to inspire and mobilize the younger generation, and really when we are thinking about setting a transformative agenda, right? This is where the change comes. So having in front of you probably hundreds, if not thousands, of the younger people, I'm going to call you Mary, Dr. Rice Institute and Personal, and Vanessa. Mary, I'll start with you. What do you want to tell them?
Oh, I want to tell them that this is the climate, this crisis is the greatest crisis of perhaps all time. It is the greatest crisis that humanity is facing right now. And yet we have the expertise to solve this problem. Together we can do it. With this kind of cross-disciplinary collaboration with the doctors who see the patients, who know what kind of health problems they're facing as a result of climate change, with the researchers who bring the data science and the methodology to try to understand this problem and to quantify what the benefits would be of some of these solutions, with industry partners who actually can develop solutions, technological solutions to this problem, with funders who are committed to funding this, to government, to our representatives who can help implement policies to solve it. Together we can do this, and we need everybody at every level. Even if you're an intern right now, working hard, taking care of patients, as Vanessa and I were together once years ago, and this might seem like such a big problem that's not relevant to you. I think you probably think it is relevant to you because you're signed into this conference right now. And I'm so happy you are, because we need you. We need every person who's on this call to participate and help solve this.
Well, I 100% endorse what Mary said, so I won't repeat that. I think I would also just want to double down, though, on the piece of we need everybody. And what that means for me is you should be very principled in what you believe, have the integrity to stand behind what you know and think to be right and to pursue your questions relentlessly. But also recognize that we have a shared interest, and sometimes it is worth engaging those that you think are your unlikely allies, those that you might think are the quote unquote enemy. And the UAE was a great example, right? People said the UAE was gas guzzling and you couldn't engage them, and they were trying to drive deals behind the scenes of COP. And at the end of the day, though, they also could be powerful agents of change if we help to have them take a leadership role. And they did use the word fossil fuels, right? They were willing to go that far. And it is, I think, by engaging the unlikely allies, it's about remembering that somewhere in there is a shared value. Either it is our children, it is that we don't want to, we want the planet somewhere. There's something that you can find common ground on. And if you can engage everybody, I think then we start to move the dial more effectively and more powerfully. And so that would be the addition I would add to what Mary said.
Great. Well, I hope you were able to enjoy this conversation and being empowered and really energized from what is ahead. I think ultimately the message here is embrace to be uncomfortable, have a lot of discipline, and be optimistic, and please work with us and interact with us. Thank you again, Dr. Kerry and Dr. Rice, for doing this. And with this, I will close the session. Thank you.
Thank you.
Thank you.